Hello, hello, hello. I am Dr. Triffy. I have decided to do a very quick, but hopefully very informative live to share with you my new upcoming, what I hope is transformative training for healers, practitioners, coaches, therapists, ministers, teachers, nurses, caregivers in the healing field, and that's such a wide span. So I am a licensed psychologist and an advanced clinical hypnotherapist in Atlanta, Georgia. I have been a hypnotherapist since 1999. That coincided with the birth of my first child. So I've been doing this for so long. And the reason I have decided to share this knowledge is really as a result of COVID. So today I'm trying to talk to my Facebook and my Instagram audience while I'm also talking to my folks on LinkedIn and YouTube who have also expressed interest in this training. So sometimes you'll see me looking down here and sometimes I'll be looking up here towards you. So last year as COVID hit, I mean, I don't know what you were doing when COVID hit. Do you remember like the first week? The first 2 weeks, I remember sitting in a corner of one of my rooms on my phone trying to do therapy. And as the time passed, the number of requests for sessions, new clients who were calling in asking for support, I mean, I was overloaded. It was too much for me. And I've heard that story from many other clinicians. What we all understand is happening and has happened since is that the need for mental health support is so great. And the need for fast, effective, evidence-based treatment is so much higher. The need has skyrocketed. And so this is me after having practiced hypnotherapy for over 21 years, having decided after last year to take a break myself, because I think as healers, you have to learn how to heal yourself first. You must learn how to heal yourself first. I took a sabbatical from individual therapy because I needed a bit of a break. And I needed some time to clear my head and to decide to use the opportunity from the COVID forced isolation to decide what my next step would be professionally. And so I am understanding each day that some of what I must do now in this time is to train others to heal themselves first. Mea culpa, yeah? To heal themselves first and to heal others. And to try to find effective ways to do this. And to never stop learning. So why hypnotherapy? What is hypnotherapy? I think everybody has heard something about hypnotherapy. I think we have our own ideas about how hypnotherapy works, what it is. We've watched movies, we've seen and heard things that seem kind of weird. And in some of the mystification, I suppose I would say, about hypnotherapy, I think many people do not yet still understand how powerful and transformative hypnotherapy is as a clinical tool. And so I shared with you a little bit of my hypnotherapy story. I learned to do hypnotherapy in 1999, and it changed my life. I used hypnotherapy to heal myself from a lot of the traumas I had experienced. And as you get to know me, as you listen to some of my videos, you will hear the story of how I lost my mother really suddenly, as she was traveling on a boat from the Caribbean. My island is Dominica originally. I live in Atlanta, Georgia, and have lived here for many, many years. But I lived in Dominica at the time as a 21-year-old, and my mother was leaving my island to go to another one, and the boat she was traveling on sank. And I paused because one day my mother was there, and the next day she was Gone, gone, and gone in a way that was so vicious, I felt, and gone in a way that I never had a chance to properly say goodbye because her body was never recovered. So 10, 11 years later, actually it was about 8 years later, I learned how to do hypnotherapy. And as I learned, I had to experience the process myself. So I was able to get my healing before I could even go to work with clients. And that is crucial. That is crucial for a healer, to get your healing first. To get your healing first. And in a continuous way. To then be able to more efficiently, I believe, offer that to the people that you work with. So, Bishop Bobby, welcome. Thank you for joining. So, hypnosis has been around for millennia, really. There are writings as early as at least 500 years BC in ancient writings, where we learn about waking sleep and treating by the laying on of hands. And as hypnosis made its progress, we have people like Freud and Mesmer and very early psychologists practicing hypnosis. What is hypnosis? What is hypnotherapy? Hypnotherapy is a combination of hypnosis and therapy. So hypnosis actually comes from the word hypnos, which is a Greek word for sleep. And I think a lot of us can relate to that understanding, because that's what we think about hypnosis. Many people think you actually fall asleep, or that you become unconscious, or you don't remember what's happening in hypnosis. I will tell you that is not correct. That is not correct. So hypnosis allows you, though, to get into a state of trance, not sleep. We don't need that level of hypnosis for healing. And it is during that phase, during that space, where you can get to a certain level of focused awareness and concentration that is not available to the mind in its conscious state. It's not available. You see, because our conscious mind is always yapping away. What do I do? My bills, my electricity, my kids, my anxiety, my worries, my fears, my traumas. That's the conscious mind always yapping like you have a roommate in your head. It is very challenging to go to the deeper places we need to go to be able to access that state of focused awareness. And so that's what the trance-like state of hypnosis allows you to do. And when you add that to therapy, a guided process with a trained professional leading you through, who knows what they're doing, you get the beautiful symbiosis, just the beautiful interaction of hypnosis and therapy that also builds on our suggestibility that is heightened during that state of trance. And suggestibility is the idea that if I make a decision in my deeper, more relaxed state of mind, where I can tap into my subconscious mind, below that level of conscious awareness, the chatty brain, monkey mind, yeah, then that new decision I make is more likely to last and to stick. And over 21 years, I promise you, I have seen this play itself out over and over and over again, not just for me, but for my clients. Okay? So, what do the major medical organizations say about hypnotherapy? Now, you know, if you've gotten to at least a master's degree in anything, you have to justify every statement. You have to justify every statement. And you have to justify every claim. So, listen to what and when the major medical organizations in the United States approved hypnotherapy as a medical treatment. So we look at the American Medical Association. They approved hypnosis for treatment in 1958. 1958. Now that is not yesterday. The American Psychiatric Association approved hypnosis in 1961. And the APA, I'm a member of the American Psychological Association, in 1993. 1993. So we're not just talking about, Johnny come lately. Hypnosis has been established as an evidence-based, efficacious way to treat, to heal, and to help. So if you dig deeper, you also find out, and I'm learning this from my clients. If they have the option to choose between hypnotherapy and cognitive work, talk therapy, CBT, which is so powerful and so useful, most of my clients overwhelmingly choose hypnotherapy. Just recently, I run this group with women, and we meet once a month, and we do hypnotherapy, and we do CBT sometimes. And we've done about 3 sessions so far. Look, by the end of the second session, they said, Dr. Wallace, we talked about it. We met, we talked about it, and we decided we only want to do, guess what? You guessed it, hypnotherapy. So I was looking at some of the research, and one systematic review and a meta-analysis of hypnotherapy in treating PTSD used literature searches from about 47 articles. And 6 of those were experiments that tested the efficacy of hypnosis-based treatments. And a large effect in favor of hypnosis, right? Especially manualized hypnosis, meaning you have a process and you have something written and you consistently follow the same script or very similar. They found that 4+ weeks post-hypnosis, that treatment effect had maintained itself, meaning clients were saying, yes, I'm still doing okay. 4+ weeks. Long-term evaluations, 12 months plus, they were still reporting they were doing okay. So hypnosis appears to be effective in alleviating PTSD symptoms. Now I'll tell you that PTSD is not the only thing that hypnosis is so amazing for and works for. Here are some other uses and some practical applications of hypnotherapy. Phobias. A phobia is a fear, an irrational fear of anything, really, whatever it is. Substance abuse, addictions, bad habits, bedwetting, nail biting, addictions, relationship recovery, healing from divorce and the trauma of that. Of course, trauma recovery, performance enhancement, test anxiety, weight management, smoking cessation, stage fright. You're afraid of speaking in public? You know what to do now. You know who to go to now. So, look, and I promise you, these are just a few of the challenges, clinical disorders, problems, however you want to call it, that you can use hypnotherapy effectively and efficiently for. It works fast. I would say over 21 years that most of my clients get a hang of their recovery process, the new skill they're trying to learn within 5 sessions. So everybody's different, of course, but within 5 sessions, by the end of 5 sessions, 5 to 6, most clients get a hang of it. And they're like, you know what, doc, I'm good. I had one teenager who was, she struggled so much with depression. And I would say she was in the category of sufferers that we might say was resistant. Her depression was chronic and it was resistant to treatment. Now, that little girl, she wasn't a little girl, I mean, she was a teenager. But after a hypnotherapy session, one day she said to me, you know, she opened her eyes and she said, oh my goodness, I've never felt like this. I feel as if my brain just had a bath. You know, I still remember this, and it touched me so deeply because I knew how much she had been suffering. I knew how much she had been suffering. And that day, just for that hour and a half, she felt such relief. She said, I feel as if my brain just had a bath. And so I'm just giving a little bit of information today. I am available by email. I'm available by messaging. I'm available. You can go to my website, drtriphi.com. You spell Triphi, T-R-I-P-H-I. So the website is www.drtriphi.com. I have created a clinical hypnotherapy certification training to get more practitioners, to get more healers certified and capable and efficient and able to use this powerful technique, to use this powerful skill to heal, like I said, themselves first and others faster. The first cohort, it begins June 4, and you'll see it. I tried my best to do a really good description of the process. Again, I'm available for any of your questions. I believe that now is a time of such need. Again, that healers, light workers, if this is what your heart has called you to do, now is the time to learn ways to heal, to treat the people who come to us faster. So I'm a person who I don't say things if I'm not going to live up to it. So I got to share this with you. This is brain spotting. How many of you have trained in brain spotting or heard of brain spotting? I am actually starting my brain spotting training this week. I start on Friday. They sent me this cool wand it's supposed to help regulate left and the right brain, similar to EMDR. And some people have called it EMDR on steroids. That's what I've been hearing. And so I'm so eager to keep learning, to keep healing myself and the people who come to me for the support that they need to be able to create the lives that they want for themselves. So I'm so grateful that you tuned in. Again, I'm Dr. Triphi My website is drtriffy.com. I'm inviting you to go there now. Go there now and click on the training tab. Click on the training tab and you will see the certification program that I offer. I offer also a life coaching certification program that is a combination of the hypnotherapy training plus a coaching curriculum to get some of you who might be interested. While you took the break, well, all of our brains hopefully took a break last year. Your heart has been telling you that you need to be helping others to heal, but you don't yet have a pathway. And you might be trained, you might have your graduate degree in something else, but your heart is calling you to do this work. So go to my training tab on my website, drtriffy.com, and explore, sit a while, and call me, email me if you have questions. Okay? In the meantime, I hope you have a wonderful rest of your day, and I hope you continue to think better so you can feel better and do better. Peace.